Mama! In today's video, I'm going to show you how to use a manual breast pump step by step, so you can express milk easily, safely, and comfortably. Let's start with a quick look at the pump itself. A manual breast pump usually has a few main parts: a soft silicone flange that goes over your breast, a handle for pumping, and a milk container where your milk collects. Most pumps are made of BPA-free, food-grade plastic, which makes them safe for both you and your baby. So, how do you use it correctly? First, make sure all the parts are clean and dry. Next, place the flange gently over your breast so that your nipple sits right in the center. Make sure it seals well around your skin. This helps create the suction needed to express milk. Now, begin squeezing the handle slowly and rhythmically. You'll feel gentle suction. That's your milk starting to flow. If it's uncomfortable or painful, stop and adjust the position until it feels right. Once your milk starts collecting in the bottle, just keep a steady rhythm. It usually takes around 10 to 20 minutes to express a full feeding, but every mom is different, so take your time and relax. When you're done, remove the pump carefully, close the container tightly with its lid, and store your milk in the fridge or freezer, depending on when you'll use it. That's it. Using a manual breast pump is simple once you get the hang of it. If this video helped you, please subscribe, like, and share with other moms who might need support on their breastfeeding journey. Thank you so much for watching, and remember, every drop of milk is a gift of love.